Welcome back. Well, unfortunately, it's that time of year where the temperatures dip below zero quite frequently, and it's dark when you leave work in the morning and then dark again when you come home. Did you know that your winter blues are actually a form of depression? Joining us to talk about this today is Sanford Health psychiatrist Dr. Mustafa Abdul Hussein. I nailed it.
Yes.
So talk to us. What is seasonal affective disorder?
So Bailey, seasonal affective disorder is a form of depression, and it's actually in the name. So if you think about it, seasonal affective disorder. So the second word is affective, which just means changes in your mood. And generally it's depressive mood, and then seasonal, of course, is with the changes in the season. And so it generally starts late fall, and then without treatment probably resolves early spring, late winter. But this seasonal pattern, there is a form that happens in the summer, but obviously in this climate, it's much more common in the winter.
Okay, and so what are kind of the things that we can do to prevent it or combat it?
Well, first, I mean, you got to talk about the symptoms, I think, and so what does it look like, right? Because then I think that matters on what your symptoms are. I think the first things you should be looking out for is changes in your mood, number one, and if you're feeling down and depressed and low and in the dumps. And then if you're having changes in your sleep, that's also a very common sign, often oversleeping. And then changes in your appetite, overeating, for example, craving specific types of food like high in carbohydrate type food, changes in your energy level, feeling down, low energy, not wanting to get up, not wanting to do anything, lack of interest in things that you normally would have been interested in at this time of year. That's also a warning sign. And then if it's severe enough, people can also have even suicidal thoughts, which obviously, seek help for that immediately. Talk to your provider, go to the emergency department. As far as the reasoning that we think is associated with it, we think it's because of the changes in the light and the changes in circadian rhythms, melatonin levels, and then serotonin. So reduced amount of light during the winter months especially is a reason for serotonin levels to dip. And then that predisposes people to depression and also anxiety, worsening anxiety. One thing I would mention is that people who are at risk are people like in North Dakota, where we are kind of at the northern, more extreme latitudes, and then people even in the farther and south, but that's opposite ends of the earth. People who have a family history of depression or even a personal history of depression, and of course, if they have a seasonal component to their mood, I would suggest that most of the people that I meet are very attuned to their body, and they kind of realize this, and they kind of know that, well, the winters are coming, maybe can we move south, or can we get out of the area? Always not an option. So therefore, what are some options for treatment, to answer your question? So
take vitamin D?
Vitamin D is an option.
Okay.
Yep,
That's what
absolutely.
I do.
Yeah, vitamin D is an option, and we think that might be a part of it. But then also, there's three things that I want to talk about. First is therapy. So psychotherapy is an option. Counseling, and what they do is really challenge some of those negative thoughts that people have about the winter. Oh, this is never going to end, and this kind of dreary feeling. And also focus on behavioral activation, so kind of get people moving and kind of get active if they can. The other option would be light therapy, and actually I brought a lamp with me today.
You called it the sad lamp, but I call them happy lamps.
Happy lamps, exactly. Well, sad for seasonal affective disorder, right?
Yes.
And so, it's actually a happy lamp. You're right. This is just one option. They're available on all major retailers. I think I bought this one online, and so you can buy it in store or online. The most important thing is the power rating, and so you'll read the description, and it's 10,000 lux. LUX, and I'm not sure what it stands for, but the reason we mentioned that rating is because the studies, when they study these lamps as opposed to normal other lamps, they use that power rating, that 10,000 lux power rating. The time frame, generally about 30 minutes, ideally in the mornings as opposed to the evenings or afternoons.
Okay.
So I usually recommend, if people are getting ready in the morning, to have it on their desk or even at work at their desk for just about 30 minutes. If people are able to use it consistently, the evidence shows that they are effective.
We have a girl here who has her happy lamp going, so it's...
There you go.
Yeah, it's awesome.
Yeah, absolutely. And so about 10 to 14 inches from your face.
Okay.
So you don't have, you don't have to stare into it, but it just kind of near your face.
Okay.
Yeah, go ahead.
So we're wrapping up on time here,
Sure.
but if people are, if this just drove home to them and spoke to them, how can they get a hold of you or another doctor at Sanford?
Sure. So, I mean, if they have a care team, reaching out to their primary care provider would be number one. I forgot to mention just really quickly, medications are also an option if it's severe enough, and also lifestyle modification, really quickly. Just sleep hygiene, physical activity. If they can go for a walk around noontime, even if it's cloudy, that's been shown to be effective. Diet, it has been shown to be effective as well to help with mood. But coming back to your question, reaching out to any healthcare provider that they know, whether it's a walk-in clinic, getting a referral. To see me personally, I mean, you know, I work at Sanford, so that would be part of that system. But.
Okay, well, perfect. Well, Dr. Abdul Hussein, thank you so much for being here today. Still ahead, how the People's Rising Academy is helping the community overcome obstacles. We'll tell you how it all works and who's eligible coming up right after this.